Hi, my name's Jody Stabinski, and I work at Penn State Children's Hospital in Hershey, Pennsylvania. I've been a pediatric nurse practitioner for 18 years, and before that, I was in the pediatric intensive care unit. I saw RSV frequently when it first came out, that attacked mostly premature infants with comorbidities. I want to talk to you today a little bit about what you may see in presentation, the support, wait, and see guidance. The presentation depends on the age of the child as well as comorbidities such as prematurity, previous illnesses that may be involved, wheezing. It is a virus, and it can be a spectrum of presentation. It can be as easy as seeing a child with nasal congestion, possibly issues with colds, all the way to increased respiratory distress where they need oxygenation and they may even need intubation. So it's a gamut of symptoms that you see. Red flags, which you as a provider need to be aware of, is when you look at the overall exam, you want to pay attention to the amount of distress they have, and that can be nasal flaring, it can be indrawing, or again, retractions, belly breathing. You can see cyanosis sometimes, and it may just be an increase in respiratory rate. Their nasal passages, especially in infants that are obligate mouth breathers, when they're drinking, their nose is so stuffed up that they can't drink, and so they may become dehydrated, and you may see that as well. Treatment goals are typically supportive care, just like any other virus. What you want to make sure of is, again, that they stay hydrated, that they're oxygenating, and that you are promoting drainage or suction from their nose. It can be as easy as just putting some saline drops in, suctioning their nose, especially before they eat. Cool mist humidifiers can help, especially keeping the nose passages open and, again, liquefying those secretions so that they can get rid of them. Offer liquids frequently. Antipyretics for fevers. You want to also treat the child's symptoms. If they've had a history of wheezing, sometimes albuterol can help. But if they've never had wheezing or they don't have an underlying reactive airway, that's when you want to make sure that they are not given steroids, which doesn't help unless there's inflammation. And bronchodilators such as albuterol typically doesn't help. But if they've had a history of wheezing, you may want to try that and then assess that to see if they've gotten any improvement from that. Prevention of spread of the disease is key. And as you as the provider need to educate them with this. Hand washing you want to make sure of. You want to also talk to them about making sure that they clean off the surfaces, the parents or the caretakers, because RSV can live for several days after. Cover your sneezing and your coughing with your elbow, as well as avoid contact with sick people. RSV used to be seasonal, but the last 2 years it has shown, especially this last year, that it doesn't matter what season. We are seeing children present with RSV, and they are becoming hospitalized, especially some of these severe cases. And again, we want to encourage people to stay at home when they're sick, and that's helpful. The shedding of the virus can take up to a week or two, and the cough can stay around for even 3 to 4 weeks. So you want to make sure that these parents and these caretakers are aware of what you want to give them. The takeaway is supportive care. If symptoms are worsening, you want to be evaluated or you want to let us know, because symptoms that are worsening can produce respiratory distress and hypoxemia. And that's where we need to get them to the emergency room or to a hospital. So again, education of what they need to look for in case the virus progresses. Thank you very much for your time.